And we are live. Welcome again to another edition of Premier Physical Therapy Facebook webinars. I'm your host. I'm a physical therapist named Curtis Pcolka. Today's topic is 6 things to consider before choosing a physical therapist. Very big, important topic. I'm going to make sure I posted this to the right area of Facebook. All right, looks like we're good. So today is an example of the perfect day of why I live in Florida and why people move to Florida. It's in Jacksonville, that's where we are. It's 65 degrees, might be a high of 70 today. There's not a cloud in the sky. It's sunny, not much of a breeze. It's just perfect. And it's probably going to carry on into the weekend. So I'm excited about that. But let's get to it. So this piece is actually pulled out of a women's health magazine. It was kind of an informational piece. So not much research has gone into it. This was just someone's perspective on what you should do before choosing a physical therapist. And I thought it was pretty good. And my boss pointed out to me this article. So I just wanted to go over it with all of y'all because I feel like it's very helpful when choosing trying to choose where you want to go for physical therapy. So there's 6 things to consider. So the first one, are they skilled at treating your specific issue? So with physical therapy, any recently graduated physical therapist has a doctorate education level. So a lot of people get confused, say, oh, I'm working with the doctorate physical therapist. Well, pretty much every physical therapist is now a doctorate. Some of them graduated years ago with their master's or bachelor's, but they could complete online courses to get their doctorate. So basically, entry level, any baseline physical therapist pretty much has their doctorate. And physical therapy, any entry level physical therapist is going to have about 6 to 7 years of studying to get to entry level to graduate with their degree. We get a lot of base training, a mix with cardio pump, some oncology, women's health, geriatrics, neurology, orthopedics, and sports, but it's all a little bit of everything. So the next question, very important, is do they have additional certifications? This is a big one, and it can be very confusing for patients to look at these credentials behind a therapist and kind of not know what they are and what they do. So I'm going to give you some of the most common ones, but there are more than these. So one of the big ones is they're usually just 3 letters in the credentials, but these are the specialty certifications. They most commonly occur after about a year of residency, which is 1 year after you graduate from physical therapy school. You do an additional year of working and training. And at the end of the year, you take a test to get your certification credentials. So I have this credential, the OCS, but I did not do a residency. And that's one of the questions you could ask your therapist is if they did a residency or not, because it is a year of intense training. And odds are, if they do a residency, that means they're really dedicated and they've learned a lot, uh, even though they could be really young. So there are other types of specialties certifications. And like I said, most of them have these 3 letters in their credentials. So SCS is Sports Certified Specialist. GCS is Geriatric Certified Specialist. NCS, Neuro Certified Specialist. WCS, Women's Health Certified Specialist. And PCS, forgot what that one. Oh, that's pediatric certified specialist. So this all depends. If you have a kid and you're bringing them to therapy, you might look for the PCS. If you have a tennis elbow or you hurt your shoulder, you're probably going to want to go to either the OCS or the SCS. If you're playing a lot of sports and it's a sports injury, you might favor the SCS. If you hurt your elbow through work or typing, you might want to go the OCS route. If you're older and you want to work on your balance, you might choose either the GCS, the geriatric certified specialist, or the NCS, the neuro certified specialist. So that's a pretty big one. It takes about a year of training to get that one. So that's a pretty powerful credential. The next one is an important credential if you're looking for someone you want someone to do some hands-on dry needling or trigger point therapy. So this is a new one to us in Florida, but it's a certified myofascial trigger point therapist. There might be some other ones developing in the future, but they'll probably have some form of trigger point in their name. That's about 1 to 3 months. They'll probably meet not every month, but I mean not every weekend, but a couple weekends a month. Then it accumulates to about 3 months to get the certification, and they have to in some certifications, you have to practice it on a certain amount of patients. So for us in Florida, it could be around 25 patients you have to practice the dry needling on before you get certified. The next one's a pretty common one. Like there's a couple different ones too, so I'm going to go over the most common ones. But these are your manual therapy certifications. This is using your hands to do therapy. Um, so a big one that comes out of St. Augustine is the MTC. So that one's locally and comes out of St. Augustine University. And then we have another one that comes out of Fort Lauderdale, which is the CMPT. Both are about a year long, about 6 to 12 months to get that. Then there's another one that's really common. It's the COMT. And that one's based out of Australia, but they do the training in the United States too. So all these are about equivalent. Uh, so if you see a therapist with this, you know they had some extra manual therapy training, hands-on training. In our clinic, we treat a lot of lymphedema patients. So if you were in need of a lymphedema or oncology type of treatment, you'd probably want to look at the certified lymphedema therapist. That's the CLT. It's about 1 to 3 months of training, pretty much similar to the dry needling courses. You're going to meet a weekend, 1 or 2 weekends maybe out of the month, and do it for about 3 months, and then you'll get that certification. And then you have the big one. This is the Fellowship of American Academy of Orthopedic Manual Physical Therapy. It's a long one. So it's the FAAOMPT. That's about 1 to 2 years of training after you do a 1 year residency. So it could be 3 years out of school, that which equal 10 years total of training. So this is a huge one. This one, not many therapists probably would have this one, but we have a therapist in our clinic who has his FIOMS degree. Uh, so he is the fellow at our clinic. But those are just important things to look at. If you are working with someone with no credentials, they probably don't have any advanced training and they probably just have their baseline training. But if you see these credentials and look them up, you can determine if that additional credentialing could help in your situation or not. So here's our clinic. So we specialized in the orthopedics because we have some good manual certifications in our group. We have a therapist with their fellow degree, and he does jaw and facial pain. Then we have some therapists with their lymphedema certifications. So we have specialists there. And then we have additional that I didn't go over, but we have also training in running and golf programs that may or may not include credentials, but it's at least training in that area. All right. So the third thing to consider is, will they give you an individualized plan? So some clinics, you might get the same protocols for everybody. If you have back pain, you get this protocol. If you have ankle pain, you get this protocol. But you really want someone who establishes goals that are important to you day one. And then you should see treatment geared towards reaching those goals. If your goal is to return to tennis, you should see some type of plan, that some type of exercise or something that mimics tennis movements, establishes a progression towards going to tennis. Um, Also, individualized could mean, do you get that one on one attention? So, not all therapy clinics are created equal. Some clinics are really busy. A therapist might have four patients at once, so it'd be impossible to get one on one care. But if you find that clinic that offers at least one on one care for at least 30 minutes, that can make a whole world of difference. First of all, it's just safer. You know, they can monitor your every movement during an exercise, make sure you're doing it safely. And you get more hands on therapy because it's one on one. So they don't have three other patients. They can do some hands on manual therapy on your body to achieve your goal of either more mobility, range of motion, or less pain. And studies have shown if you do manual therapy combined with exercise, the manual therapy can make the exercise more effective. Uh, so, the fourth thing to consider is, do they put you at ease? So, what does that mean? Is, do you just simply, your gut feeling, do you trust this person? Are they trying to scam you to get money out of you? Because that's not a good feeling. Or are they really trying to help you? Are they listening to you when you're talking to them? Uh, Also, do you get along with them? Are you relatable? Like, they could be the best therapist in the world, but if they don't relate to you, they don't understand what you're going through. If you have cancer, if you have this injury that's really depressing, if they can't relate to that, then it might be hard for them to see what's important to you. All right, number five, do they let machines do all the work? So, a lot of clinics overuse ultrasound, electrical stimulation. They might have all these machines that they put on your body, but that's not always the best form of treatment for you. And they could be using it just because they're really busy and they don't have time to do some hands-on therapy. So they're hooking you on a machine to make life easier for them. And it's not their fault. There's, they might be at a place that has their protocol as you work with four people at once, or three people at once, or two people at once. Uh, and then, are you finding yourself doing the same exercises for multiple days and weeks? And even myself, I've been guilty of this, but a good clinic and therapist will try to progress your exercises as often as possible. If you are doing the same exercises you did day one as day 10, then that's a red flag. You should be progressing into harder exercises unless there's a reason not to, like you had a flare up or you can't progress to the new ones yet. So there's a reason why they're keeping you at the same exercises, but they should be giving you new ones every week at least. And then, do they give out homework? 1 hour appointments 2 to 3 times a week just isn't enough to make the changes we need most of the time. So usually you'll have to do some stretching at home. And one way to remind you to do that is some take home material, some printouts, some bands, some education on how often to do it a day, when to do it, and what equipment to buy for your home. And that can make all the difference, for you getting better faster with less visits in the clinic. So, in conclusion, not all physical therapy clinics are created equal. Uh, this is a very important video to watch or show to somebody so they can make a decision, or at least when they go to clinic, they can know some things on whether or not they want to stay at that clinic or maybe try to find another one. Maybe they want to try to go after some reviews to see what people have been saying about certain clinics and if they think that's a good match. Look on the clinic websites for the certifications of the therapist to see if it's a certification that will help you out. And those are all just extremely important things, not only for physical therapy, just for any form of choosing a restaurant, choosing a hotel, just everything is it's very important to do your research before you just randomly a clinic or pick something just because of location. You want to go a little bit more into that. So here's the reference. It was from Women's Health magazine, which I actually never heard of before, but it has the same almost logo, or the same type of, I forgot how you say that, fonts as Men's Health, but it must be made by the same company, but it's Women's Health. All right, so I'm just gonna look to see if anyone had any questions. Let's see here. This will only take a moment. All right, I don't see any comments, so I think we are good. So for all of you who watch, thank you so much. We try to do these every Friday. If you've missed one, they're going to be on our website and they're going to be posted, uploaded to YouTube later on. So thank you again and have a good weekend. We are out.